Hi, my name's Dr. Paul Thompson. I'm the Chief Medical Officer for Launch Medical. I'm currently in private practice, practicing integrative medicine and a urologist in Fort Worth, Texas. We've currently calibrated our Phoenix Pro, and it is a 3.0 bar and 20 hertz. This is the most common setting we use in both our clinic in Fort Worth and in California. The difference between the Phoenix and the Phoenix Pro is fairly simple. The Phoenix is limited to 15,000 shocks. And after each 15,000 shocks, there's a 36-hour lockout. This is basically for safety. These people have not been trained by a physician. The Pro has 20,000 shocks per treatment and has no lockout. Now, again, these people are under the supervision of their physician, and they have been trained by their physician. Many people report no discomfort whatsoever. We don't see the need to apply any numbing cream because it is, I'm not going to say painless, but it's pretty darn close. Clinical studies on the Phoenix Pro are limited just due to it being in production such a short time. The Phoenix Pro is exactly like the Phoenix, and we know through measurement of the sound wave, penetration, etc., that is identical to the machines used in physicians' offices, and there are multiple studies that prove the efficacy of the shockwave treatment. To obtain the Phoenix Pro, one does need to see their physician that is working with us. They will not only be evaluated in the physician's office, they will also be trained on the use of the Phoenix Pro. We're suggesting that the Phoenix Pro be used in conjunction with GAINSWave treatments. Many of our patients will receive the GAINSWave treatment and do follow-up home maintenance with the Phoenix Pro. We also have recommended several patients to have treatment with just the Phoenix Pro. Again, they would receive the Phoenix Pro and be evaluated by their physician and be given explicit instructions on how to use it. Patients with prolonged ED, 15, 20 years, have seen great success with the Phoenix and the Phoenix Pro. This is due to several reasons. Those people are suffering from vascular problems, and vascular problems are systemic, and many of these people have cardiac problems as well. But what we're going in and doing is we're causing neovascularization or regrowth of blood vessels. So even though we may supplement their treatments with some of the pills that we use for erectile dysfunction, even if they didn't respond to those pills prior to treatment, the majority of the time they will see great results using the Phoenix Pro, even when resistant to Viagra Cialis prior. Peyronie's disease as a urologist was a nightmare. I was most excited about being able to use this type of treatment for Peyronie's disease for one reason. There was no other good treatment. There were multiple treatments, and when you have multiple treatments for a problem, it means there's not a good one. No one was satisfied, patients weren't satisfied, and what we're seeing now is we can go specifically treat that scar tissue, get it to vascularize, and repair itself. We've seen amazing results, decrease in pain and decrease in the scarring. Peyronie's disease has now found a treatment with the Phoenix Pro. Results with the Phoenix Pro are usually seen in 6 weeks. It takes about 6 weeks to start to see the neovascularization. Of course, we always have people after their first treatment tell us how excited they are to have a fantastic erection. I can't claim that this is all due to neovascularization because it certainly doesn't make sense. But we do know at 6 weeks, we see significant regrowth of blood vessels. There's always concern of harm when using these type of devices. The difference, again, with the Phoenix and the Phoenix Pro is how often you can use it, the number of shocks or sound waves that are emitted. And with the Phoenix Pro, again, you have professional supervision. The optimal use of the Phoenix Pro is twice weekly. We don't see a great improvement. Most men, because we're all kind of alike, think if a little's good, a lot's great, but that's not true in this case. Just like going to the gym, we work out. If we work out too much, the results aren't as good. But if we give our body time to repair from that workout, then we do much better. And the Phoenix Pro is exactly the same. There are minimal, if any, side effects, maybe some mild inflammation at the skin level, but that is all. The use of the Phoenix Pro at home, again, we recommend on initial treatments no more than twice weekly. And that, again, is because that's the optimal results. We think this is fantastic, it works the best, and our patients are the happiest. You can use this periodically at home. There's no limit to how often you can use it. And if you did it twice a week for 4 weeks and then followed up once a week or once a month, there's no limit to the use. And a lot of people use it just for a little boost on a monthly basis. We recommend that everyone who uses the SoundWave device, the Phoenix Pro, they use a penile pump. The best results we've seen with the Phoenix Pro, with the Phoenix, with GAINSWave, is when combined with a pump. The only limitation on the pump is to either make sure there's a limiter on the pump so there's not too much vacuum created that could cause some bleeding or damage. And really, it kind of gets glossed over by physicians as, oh, it's just a penile pump, but you can do damage with a penile pump. There's probably more risk with the penile pump than there is with the shockwave itself. And like I said, there's minimal to none. So obviously there's more. But we recommend that you limit it. We have a limited recommendation on our pumps so our patients don't overpump. But the pump is fantastic and the results are very good when combined with the Phoenix Pro. Everybody wants to know, it's going to make my penis bigger. Well, if you're not getting adequate blood flow into your penis, it's not going to be as long or have as much girth. And so the appearance is it will look bigger, but in reality, you have what you have. We're not going to make it longer like it says in the back of the magazines, but we are going to make you all you can be. While using the Phoenix Pro, there's no limitations after treatment. We tell our patients to go on about their normal life. They can have sexual activity on the same day. I've had multiple police officers working beat drop in on their lunch break, get treated, and go right back out to police work. So there's no limitations to what you can do. You can be sexually active when you're doing it, after you're doing it, before you're doing it. The use of PRP, exosomes, etc., enhance the use of shockwave, sound wave therapy. The Phoenix Pro, just like the Phoenix and just like GAINSWave, the results are enhanced when using PRP or exosomes. We know that in the PRP, there's many growth factors. In exosomes, there's actually microRNA, messenger RNA that go in and are attracted to that area. We know there's stem cells already after treatment. And so we go in, flood that with 11 different growth hormones and the exosomes, and we get fantastic results again. Because we're really going in, we're revascularizing, and we're helping the area revascularize as well with the exosomes and the PRP. The maintenance program can be anywhere from once a month to once every 2 weeks to once a week for the guys who think they need it. There's no limitation. Again, I'd like you to use it no more than twice a week. There is no limit to the number of treatments you can do with the Phoenix Pro. And I don't mean, again, I'm going to say it one more time because I've said it 100 times already, twice a week. If you want to get the best results, do it twice a week. Don't do it every day. Rome wasn't built in a day. And we're going to do it twice a week, and there's no limit to how many you can use. Once you're having fantastic results and good erections, you'll tend to use it a lot less and only use it possibly every 2 weeks or once. When using the Phoenix Pro, there's several things you have to understand. Like the GAINSWave, this is not focused technology. That's why it's so safe to use. The penetration is such that it will go millimeters into the skin, but it's fairly superficial. We're lucky with the penis because there's really not that much depth necessary to get into the corpus cavernosum or into the Peyronie's plaque. But we also see it for superficial tendons. So if you were looking for a depth, it's going to be several millimeters. It's equivalent to GAINSWave in depth. When you switch to a focused technology, there's much more risk of damage, and those will never be home devices.